Appendiceal nets are usually positive for CDX2, but they can also be positive for something called PSAP, which is prostate-specific acid phosphatase. You may call it something different in your lab, but I bet you have it. But I also want to point out that there are at least 2 different cell types that can give you neuroendocrine tumors in the appendix. The majority are serotonin-producing EC cells, and those are the ones that we worry about because they tend to be much more infiltrative. But if you have a well-delineated tumor like this, you should think that maybe this is going to be a different cell type, and there's a lot of literature showing that L cell tumors in the rectum are much more benign in behavior than other rectal nets, and I think the same is probably true for appendix. And all of this has implications for what the clinicians use to follow the patient. Because if you just tell them there's a neuroendocrine tumor, they're going to start measuring 5-HIAAs on these patients every year. And if the tumor is not making serotonin, which is what gives rise to 5-HIAA as a breakdown product, they're wasting their time and the patient may have progression without them knowing.